Hello, and welcome to Virginia Medical Update Show. I'm your host, Mahnojon Mahmadova, and today's program is sponsored by Virginia Family Medicine. Virginia Family Medicine integrates functional and alternative medicine in their practice to complement their expertise in medical care. Their areas of specialties are in weight management, preventative medicine, and holistic health. Our next guest is a board-certified physician assistant. She received her bachelor's degree from Tufts University and her master's degree from Seton Hall University. She had been working as a physician's assistant in family medicine since 2003 and has extensive experience in all areas of family medicine, seeing a wide range of patients of all ages and treating both acute and chronic health conditions. She joined Virginia Family Medicine in 2012. She is also fluent in both English and Vietnamese. It is an honor and pleasure for me to introduce to you all Han Tran. Well, first of all, welcome, Han.
Thank you, Magnos. It is awesome to be here today with you.
Thank you so much for joining and coming to us. So today's program, we would like to talk about gastroesophageal reflux disease. So could you please tell us what is GERD means?
So gastroesophageal reflux disease is also known as GERD. A lot of people just say, hey, I have GERD. It is a very common condition affecting a lot of people. It causes burning, it causes inflammations, maybe even cancer in our stomach or our esophagus, in digestive system. Very, very common.
How common this disease is?
So approximately 1 in 5 people in the populations will have it. Mm-hmm. It can affect men, women, the young, the old, even children too. So it's important to talk about it. Mm-hmm. A lot of people, they have it and they don't even know that they have it. And if you don't detect and treat on time appropriately, and once it leads to cancer, it's not so good.
So the question is here that came up to my mind, how do we know that one has this GERD?
Okay, very mild symptoms that people can ignore it can be just indigestions, full feeling in your stomach. It can cause some heartburn, warm feeling in your stomach or in your esophagus, behind the chest bone. Some people think, oh, I have heart attack, I have heart problem, but in fact, all they have is GERD, the reflux, because the acid, it goes upward and it goes from the stomach up to your esophagus to the mouth. They can have sour taste, they can have voice changes, they can have teeth erosion, the dentinotis, or...
Is it pretty noticeable? Like
yes.
You could notice from the first day, or it's over the time, basically in a month, in a year, you would notice.
It can be acute or chronic. You can notice it within a few days that it come. Mm-hmm. If you go to your doctor quick and we examine, and most likely you have it, and we treat it very easy. Some people, they just, oh, let me go to the pharmacy, get some over-the-counter treatments, and it just subsided a little bit, and it come back and forth, and they don't get treated, they don't get it examined and diagnosed, then it can lead to chronic inflammation, ulcers, anemia as complications, and the worst that we are fear of is cancer of the stomach or esophagus.
Well, that's very unfortunate. So the question is here, basically, how do we diagnose this?
It's pretty simple to diagnose. Yeah, so once I see a patient coming and examine, most of them, when I check the abdominal, they have some tenderness, pain in the stomach area, and we do a breath test for a bacteria that usually grow in the stomach, the H. pylori. That we can talk about it later. Right. We order diagnostic tests. There is one we call upper gastric series. It's pretty simple, non-invasive. You just drink a solution of contrast, and then they take series of X-rays to look for any narrowing, any size of the vein enlargements. it can look for reflux. It can look for ulcers as well. They have a invasive test we call it upper endoscopy, which is done by a gastroenterologist, a specialist, and they might put you to sleep, put a camera through your mouth, and look inside the wall of the esophagus or the stomach.
To the monitor.
Yes, to monitor, and then if they see any growth, they can remove and send to the lab to make sure is it normal or abnormal. And then depends on what you have, then the appropriate treatment is decided.
Is there any particular seasons that people should come and do those kind of tests, or anytime during the year?
Anytime during the year. It's really not seasonal specific. It's more of the population specific. A lot of patients from Asia, a lot of patients from the Middle East, we eat more spicy foods, and people have more. But now lately, I've seen a lot of Caucasian, African American having it too.
So in this case, the very normal question I guess we should ask, how to prevent this?
Yeah.
How to prevent GERD?
So to prevent it, lifestyle change is very, very important. You look at what food that you eat and to make it worse, to bring it on, reduce stress, lose weight too, because as you know, most Americans now are overweight or even obese.
That's
so
right.
lose weight definitely help. You avoid foods that high in acid contents or spices. It doesn't matter if it's hot and spicy. Just the spice that you add on to marinate your food can bring it up too. Caffeine is big. Mints is also not stomach friendly. Big thing, don't smoke or stop smoking. Smoke can make it worse too.
And drinking alcohol too?
Of course.
Okay.
I almost forgot that thanks to you. Yes, alcohol is a big one because it can burn the stomach lining. If you have the good get treatments. So common treatments include over-the-counter antacids like Tums, Maalox, or antihistamine, the H2 blocker. They reduce the acid stomach. Like Zantac or Pepcid AC, Tagamet. Another class of medication we use is proton pump inhibitors, which are common over-the-counter now. Nexium, Prilosec, and they have to reduce the stomach acid too differently than the H2 blocker. And if you use over-the-counter before you see the doctor, that's fine. But if your symptoms not better after 2 weeks, then go and see us when we do more tests.
But it's also very tricky because if you're gonna use the medication over the counter without knowing the exact symptoms, it could be dangerous as well.
It is. Right? So I tell my patients, you just give it 2 weeks for over the counter if you
don't see any results,
don't have access to your doctor, then you don't feel any better but still not completely 100 better, then come to see us. Because it's not fun to have cancer as the end of the road. So it is preventable, it is treatable. Don't ignore it, and don't just rely on over-the-counter or family advice. Oh, take this and don't see your doctor. See your doctor, trust on us. Very important.
That's a very good tip. That's a very good advice. Thank you so much, Han. This is a very informative and very valuable knowledge that you shared with us today. And it's an honor and pleasure for us that you came. And I know how doctor's schedule is very busy, but you found the time to join for our program. Thank you.
You're very welcome, and it's awesome to share because a lot of people don't know, and I want people to live healthy.
That's right. That's absolutely right. So thank you, dear viewers, for watching us. So we hope you enjoyed watching our show. Please don't forget to share our videos on Facebook, YouTube, Twitter, and all other social media. I'm your host, Mahnoor Mahmadova, wishing you health and wellness. Until next time.